Push up. Well done.
High five.
Sit nice and calm. You're in the back of the ambulance, OK?
We're back with the West Midlands Ambulance Service.
Clear left, go, go, go.
As the paramedics take us to the heart of the action once more.
What's happened then, mate?
Listen to me, I know you can hear me.
Can't leave you like this, can we?
Old friends are back on shift in Dudley.
What have you brought to work? That's like the kitchen sink.
And new friends return.
Brace yourself.
As we head back to Stoke.
999 mode. Activated.
Here, the crews face life and death decisions.
You need to spit that out because it's going to make you really poorly, isn't it?
And deal with adrenaline-fueled challenges.
Stop.
Body-mounted cameras capture every moment,
They tickly toes.
showing you what goes on behind closed doors.
Just a stupid old woman.
You're not a stupid old woman.
Straight in, I told you I was good.
This is a paramedic's eye view of life on the road as they battle around 4,000 calls each day.
I feel like I've wasted your time.
No.
Don't be daft. You've been in an ambulance before?
Not today.
Not today.
You'll be on the front line with them as we take you inside the ambulance.
Let's go save the day.
Sometimes I get so excited, I drive home from work and my head out the window and sound like an ambulance. Woo! No, I don't. I'll never do that. I'm normally shouting, get out of the way!
No, I'm going right. I'm going right. I'm going right.
Can't hear you.
I'm going right. Hello.
Oh, well done. Oh, you've just completely blocked the way now, haven't you?
Oh, that was impressive. See, you've got such control over that.
I have control over all aspects of my life.
In Dudley,
Right.
Okay, we're good to go.
paramedic Darren Westwood and ambulance technician Anna Ray have just received information about their next patient.
Job's come through as a Cat 1 to a lady who's 54, and it's come from 111 for delusional sleeping a lot, milky colouring liquid from NEP. I don't know what that means. I'm sure we'll find out more when we get there.
With little information about the patient, the crew aren't sure what they're heading to.
There we go. Hello, sir.
Jake, the patient's son and full-time carer, is waiting to take them in to his sick mum.
Hello.
Yeah, as you can see, it's just in the frosting, the bag's gone all gammy again.
Yeah.
She's very in and out, very cold. Like, you can't get much sense out of her. Like, this has happened before, and it was sepsis, so I didn't want to take any chances.
What does she normally suffer from?
She's got stage 4 cancer. And I've been a frosting the bag on since. When was it, Mum?
October.
What was the reason behind it?
Because the pressure on the one kidney from the cancer, like, it wasn't working properly. So that's obviously just a bypass, and just straight from the bladder.
Jane was diagnosed with terminal cervical cancer in 2017. This has caused her complications when passing urine.
And how long's Mum been poorly this time round, would you say?
This is probably about 2 or 3 days like this.
2 or 3 days?
Yeah.
Okay.
Just have your hand just to check your blood pressure.
Where is the cancer? I know we've had kidney 1.
Just 6 weeks ago, Jane had a severe headache. Doctors broke the news that her cervical cancer had now spread to her throat and brain.
Hello, Jane. How are we doing, sweet? You've had better days, ain't you, sweet? All right. Do you feel any different in any way over the last couple of days? I know your son's explained a lot. So you know any extra or new pain or... Where's that, sweet? All in your belly. All right. Can I have a look at your belly, sweet? All right, sweetie. Whereabouts is the worst of your pain, would you say, in your belly? Down here, sweet. Okay.
Do you want to pop her on some oxygen?
Yeah, let's drop her on a couple of litres, see if we can tickle her up a little bit. 280.
be on some oxygen, darling, okay? Just to help you breathe.
I take it she's bedbound now.
Normally she's not this bad. This is only because of the infection, I think. They did say that it's better for her to sleep as much as she can. Like, she ain't got the strength to like basically lift herself up so I can dress her or anything. Like, it's a right struggle at the minute. It's never normally this bad.
Anna has found Jane's most recent hospital discharge letter. It confirms Jane has been fighting cancer for a very long time.
She's had it through 89, 90, 91, 92. Then I think it's gone into a recession. And now it's back.
Having discovered Jane's full medical history, Anna wants to speak to her mum, Alice, to see if there's anything else the crew should be aware of.
I'm sorry if it's gonna be an upsetting question for you, but has she got any DNA form?
Have I had one of them yet?
She hasn't had one.
No.
Because in a situation, if God forbid something would happen, we would have to start.
Yeah.
Yeah. Okay. Oh, bless you.
DNAR stands for Do Not Attempt Resuscitation. It allows caregivers not to intervene should their patient's heart stop.
I'm sorry that I've upset you.
You haven't. I've been like this now for over. We went to see Dr. Allerton last Friday and I knew it was good news.
Oh, bless you.
You know, I'm 82. It's only 54.
She had a cancer ages ago as well, didn't she, when she was younger?
Yeah, in the cervix.
In the cervix, yeah. That stopped. Yeah, and now it's come back.
The last time we went, they said everything was fine.
Yeah.
Now it's gone to her brain. I don't deserve it.
Oh, yeah. Life can be horrible.
It can, yeah.
I always find it difficult when dealing with patients that have had prolonged serious illnesses, because it's hard to give them reassurance that everything's going to be fine.
And it's not just the patient we have to deal with, it's the family as well.
I mean, this lady was in her 50s and her mum was next door. I mean, that's not right, is it? So. Jane, we're going to pop you down the hospital, sweet. Okay. And get this kidney problem sorted. We're going to look after you, sweet. Anything for you, sweet. Hopefully it's just a little run-of-the-mill infection. We'll get you sorted and back home with some antibiotics, eh? We don't want to be in hospital, do we? Really? Yep, I could imagine so. Do you want to sit up for us? Nice and slowly. Oh, be calm, we can do it. Come on. That's it.
Go.
Okay. Okay, take a breather.
Don't run into it like a bullet china shop. Take it nice and steady. You're doing great. Go on then.
Onto the chair.
Onto the chair.
Nice and slow.
There you go.
With a bump. I know, it's uncomfortable, isn't it? But we'll get you off there as soon as we can and onto our bed.
I'm gonna tilt you back. Don't panic. It's
Yeah,
all right, don't
you're
panic.
fine.
I've got you.
Oh my God, I thought I was going back.
Nah, it is a strange sensation, but you're sound. We'll just pull the door to. Let's get you unwrapped. And this is where you hold me and I hold you. 1, 2, 3. Up we come.
That's it. That's it. Lovely. You want? Okay?
Think so.
Right, young lady. Pop a bit of oxygen on you, sweet. Get some twinkle back in you. I'm gonna pop this back over your nose. If it becomes uncomfortable, let me tell me, and we'll move it. All right.
You're coming, Jake.
Yeah, of course I am. You want to just stick a bandana on?
Yeah?
Yeah. Looks like in a motorbike gang with a bandana on.
One of the recent symptoms of Jane's illness is that she's been off food and drink.
I'm gonna try and pop a needle in your arm, sweet. All right, to give you some water because you're a little bit dehydrated.
That make you feel better. Hard as nails, your arm will go.
No pain there when I push the flush in.
Any pain, Mum?
See
Well, I shall go and sit down.
There you go in the full trim, I'm over blues and twos.
Yeah.
Marvellous, awesome. Okay. We need to get you eating again, don't we? What's your favourite food?
Anything
Chocolate?
sweet. Yeah.
Like a bit of chocolate, do you?
Yeah. At the minute, I'm a really big fan on chocolate biscuits.
Oh, good. That's not going to be too bad, is it? At the end of the day, you can afford to have a couple of packets of chocolate biscuits, I think. Anything to keep your energy up. Put them calories back on. What's your favourite drink? You're going to say gin and tonic?
No.
Teas. You're a tea belly. That's typical black country, isn't it? You all like our tea. Was it British? Typical British, Amy. Tea wallers. It's all right. Couple of bumps down here, Jane. What a wicked, wicked illness that is. It's got to be bad for the mom as well, I would imagine, losing your child. No parents.
Yeah,
should lose
exactly.
it.
She kept saying, she's like, oh, I'm 80. I think she said 80, 82 or 86. She said, and she's only in her 50s. She said it's just not fair.
We were going to a job when we first started, and there was a few coppers. Honest to God, they must have got these coppers off a calendar shoot. They were all like really good-looking men.
Have you ever played that game with your other half called online shopping?
No, what is
So,
online?
if you look at somebody and you think, oh, they're quite nice, you add to basket. But if you would go a bit further with that person, you would proceed to check out. It's a nightmare when you get like unidentified object in the bag and area.
Have you got any pick-up lines?
Have I got any pickup lines?
Yeah.
No, mate.
You just want to share them, that's all it is. Yeah. Ooh.
You know, they always say about women like men in uniform. What is it for men then? You're like air hostesses and nurses.
No, not nurses.
Well, yeah, that's
Christ.
the thing.
Oh, that's a bit hot-blooded.
Technician Dino Gould and paramedic Hannah Alexic have just finished a tea break when their next emergency is radioed through.
28-year-old, abdo, pain, bleeding with clots, so could be a miscarriage, possibly. It's not too far away, I don't think. 5 minutes.
Dino's 25 and is 12 months into his paramedic training.
So there might be quite a few things going on with this lady. If it's potentially a miscarriage, she might not know she's pregnant, or she may have just had surgery. You know, it may just be a period, we don't know yet, do we? And the main thing to find out is if she's pregnant or not.
Yeah.
Hannah, also 25, has been a paramedic for nearly 5 years.
Just here. Hello, you alright? Are you a family member?
Maggie's daughter Claire was driving home from work when she suddenly started experiencing severe abdominal pain. It was so bad, she stopped at her mum's.
Hello, Claire. I'm Hannah, this is Dino. What's been happening, sweet? What can we do for you?
I've been like my usual, the cramps and stuff in the past few days, but
Yeah.
I'm staying with the past couple of hours. It's got
Got a lot
bad,
worse.
and I've started passing my clots, and I've been taking like naproxen all day. Then I took tramadol, and it's still not.
It's just not touching it. All right, sweet pea. How long have you been passing clots for now? So it's about 6 o'clock in the evening now.
Since about 4-ish maybe.
About 4. Is it quite a few that's coming away? Are you still bleeding now?
Yeah.
Yeah? All right. Is there any chance that you could be pregnant, Claire?
I had it tested at the hospital. When did I get 3rd of August? Because I had to have, you know, where they put dye through your tubes.
Yeah.
I had to have that done and they did a test and that's all negative.
Yeah. Claire had been diagnosed with a condition called endometriosis, which affects the womb. It can affect fertility and is extremely painful. There's a strong theory that it could run in families, and there's a lot of research at the minute on what causes it. It can often affect their day-to-day lives. It can be quite debilitating. What's the pain out of 10 at the moment, Claire? A 10? Okay. What we can do for you, I think we're probably going to have to take you up to the hospital if you're in this much pain. What I can do for you, pop a little needle in and we'll give you some paracetamol IV. It's going to work a lot quicker, and if you've not had any of that, we'll try that first.
Yeah.
Yeah. Is that the easiest position for you to be in at the moment, Claire? Yeah. All right, sweet pea. I'm just going to
get worse, and then I pass the clot.
Right.
I've never had a kid, but it feels like I'm pushing.
Right, okay. So I've got a slight temperature. It's 37.8, but it's creeping up. So it's possible that you've got an infection.
But I've not had clots like this before.
Not had clots like this before. That's fine. Not pregnant, as far as you know. Never had a miscarriage. You have? How many times have you miscarried?
Just once.
Just once. How far along were you?
Not many weeks.
Not many.
About
5 weeks, okay.
Claire has a complicated medical history, but the crew's priority for now is to try and reduce her pain.
Thank you very much. You had gas and air before? Yeah? Should we try with some of that? Yeah?
There you are. Tight seal with your teeth around the mouthpiece, like you're sucking a milkshake. That's it.
Is that easing it at all? A little bit. You've got half to go. Okay, we're not in a rush. Get your pain under control. You're looking a bit easier now, Claire. You feeling it? Good. So if it was a 9 or 10 before, what would it be now? 7. So we're coming down. Are you ready? Grab onto me. Just get your bearings, get your sea legs first. Are you quite tall like me? Yeah. All right, sweetheart. Okay. That's it. Pop your feet up. Don't worry about your slippers.
Priorities, hot water bottle.
Now that Claire's settled onto the ambulance and the pain relief is working, Hannah wants to examine her properly.
Am I okay to have a little look at your tummy? Is that okay? To match your pink pyjamas, I've got my pink stethoscope. So just point to me where the pain is, all across there.
Yeah, and then you shoot down as well.
Can I have a little press? You let me know if it's more painful. There. Any down there?
On this side.
On this side. How old were you when you had your miscarriage?
21.
Did you know at the time that you were miscarrying?
I didn't know I was pregnant until I miscarried.
Right, okay. And do you still feel like you're passing clots? Yeah. Do you want some more gas and air? No, a bit sick. Should we give you an anti-sickness and see how that feels? All right. What's the pain at the minute, Claire?
It's going back up a bit.
It's going back up a bit.
Right, I'll go and kick the engine up and get some aircon running, I think.
With the anti-sickness kicking in,
Good to go, Dino Tar.
Okay.
Claire continues with the gas and air to try and control her pain.
So we were saying that Claire suffered from endometriosis for a long time. Yeah. And my sister's got it as well. Do you have it?
No.
No.
But
We think it might be from the dad's side.
Right,
But we
okay.
don't know because his mum was over 37 when she died.
Oh, how old was your sister Claire when she got diagnosed?
She was 24.
24, and you were 21?
I was 19 when I got
19.
diagnosed.
So you say you're going through fertility checks at the moment. Do you want children? Yeah. Yeah. Okay. Fingers crossed for you anyway. I'll just park up.
How are you doing, Claire?
Been better, haven't you?
Has that pain eased at all? Slightly. Comes in waves.
You're
Are we ready then?
Couple
of bumps on the way out.
Claire will now be seen by doctors who will need to complete further checks to confirm if her endometriosis is the cause of her symptoms.
Claire was nice, wasn't she? She's obviously in a lot of pain. She's obviously tried her own pain relief and that's not worked, so something's going on. But I hope she does get a family in the end.
Hopefully she will one day.
Can't imagine what it's like to be in that situation yet though, because I know I'm not there yet, thinking about families or anything, but you can sort of relate. She's not that much older than us, is she?
No, she's not at all.
My favourite film of all time is Ghostbusters.
Oh yeah, the new one's rubbish though.
Oh God, yeah, don't
The
even
new
mention
one's
that to
awful.
me.
You watch Casualty?
I do watch Casualty. And my husband wishes I wouldn't, because I do spend most of the time screaming, "What are you doing? That's so wrong, you can't put that there."
They actually have like medical advisors, don't they, for programs like that?
Yeah.
Apparently.
They do, apparently.
The most recent movie I've watched was I went to watch Mum and Me the other week. That was awful.
Just get out.
That was awful.
Just get out
That
of the
was
ambulance.
awful. That was awful.
Next thing you're going to tell me is wear women's underwear. I don't want no, Addy.
Weekend.
I don't want no.
Right, let's go.
999
Hey, slow it down.
Paramedic Darren Westwood and technician Ash Bolus have just received information about their next patient.
Cat 1, a 16-month-old female that is vomiting, very vacant. Feels she's having unresponsive episodes.
Category 1 means the baby girl's condition could be life-threatening. The crew get to her house in just 7 minutes.
Arrive for your room, activating.
Oh boy.
16-month-old Madison is with her parents and her brother Fraser.
Hello.
Hello.
Nicola, Madison's mum, called 111 as her baby had been unwell since the previous night.
In the night, she'd been sick. That was at 1 o'clock. She was very restless then for the rest of the night. She slept most of the day. She's been sick 6 times in total. I wanted to speak to a doctor, so I rung our own surgery and they said ring 111. Rung them and they said they were going to pass it on to yourself.
Madison? Madison? Hello?
Got bed hair.
Any allergies at all?
No. I was off a feed yesterday.
Yeah.
But she had little bits, a little bit of milk.
She's hot.
She's hot.
She's hot.
No, we've checked her temperature. That was okay, wasn't it? The one episode which concerned us, and this is why we've been sat watching her.
Yeah.
She was lying there, and I'd shouted at. She was awake.
Yeah.
Madison, nothing.
That's a
wouldn't
walkie-talkie.
respond, wouldn't
Yeah.
turn her head. So I went up and I pushed her She didn't move.
All right. No complications at birth?
No. She induced, but
Induced. Everything else was fine.
Yeah.
Okay. What we'll do is a couple of checks.
Okay.
And we'll see where we go from there, all right?
Lovely, thank you.
Obviously with children it's difficult
Yeah.
because they can't tell us what's going on.
Can I pop this in your ear?
Yeah. So there you go.
Listen for the beep.
You're very good, aren't you? You're an excellent patient.
So thank you.
36.
Can I have a quick listen to her chest and her tummy, just see if we can identify anything there? Bit of a mystery really, if I'm honest, because everything that we're adding, obviously the loss of appetite and obviously that you're concerned, that's my worry. Our observations are okay. She's not got a temperature which we'd be looking for in terms of, you know, infection, whether that be viral or whether that be bacterial. This is where the potential where she might cry a little bit because we need to take a little spot of blood out of her foot.
We're used to this with little man, aren't we?
Are we?
Yes. He does have trouble with his blood sugar.
Madison's brother Fraser has a condition called ketonic hypoglycemia. His blood sugar levels can become dangerously low if he goes without food for a long time, such as at night.
Sugars are a little bit on the lower side. So we'll test that. Ready?
If Madison's glucose levels are low, it could indicate that she has the same condition.
Could do with a little bit of a feed.
Yeah, I did. Do you want to, have you got if you just prep a little feed or a little bit of juice in the bottle, see if she takes anything.
The crew want to see Madison's blood sugar levels come up before they decide if she needs further treatment.
We don't know, mate.
Don't know yet.
We're going to see how she
What's
goes.
on your pyjamas?
She'll be cold on her tootsies.
Green. Is it your favourite colour?
Yeah. Oh.
Yumma.
Want some of this? Want some milk?
Her blood sugar is 3.1.
Yeah.
Essentially, it should be 4.2 and up.
Oh, right, okay.
Above. Given the fact that she hasn't had much of her feed, it's going to drop. And that's my only concern, is that if it continues and it's something, then what are we going to do in terms of counterbalancing it? We'll see how she takes that bottle, see how much she gets through. What do you want to do when you grow up?
Motorbike.
You want to ride a motorbike?
I'll be a fireman.
Fireman?
Fireman on a motorbike.
Yeah.
Don't blame
That's
you.
a cool job.
Sweet. Come on.
I think he's tired.
Do you think?
I'm tired.
Yeah.
Are you tired? I'm basically around your bedtime now, isn't it?
Yeah. He's usually in bed for 7.
You're staying up late now, aren't you?
Yeah.
It's 8 o'clock.
We better go get an ambulance quick.
Yeah, to get you to sleep.
Although Madison's health checks are mainly fine, the crew are concerned she's still reluctant to feed and very lethargic.
I think given everything, safest bet is to pop her down to Russell's Hall. It's purely for the fact that she's just not her normal self.
Do you want to carry some stuff out for me? Carry that then. You pick it up.
It's a bit heavy.
Oh, well, yeah, okay, you pick this one up then.
I've got big muscles.
You pick. Oh, I've got it.
I got big muscles. Look at me.
Yeah.
I got no cushion.
Well, you're going to stay here with Dad, and then I'll.
You're staying here.
I'm staying here.
Yeah.
Please.
Unless you want to drive the ambulance in. Can you drive an ambulance?
No.
Oh.
Come and pop her on the stretcher. How's that? Is that better? Is that better? Do you want to sit there next to her, Mum, if you pop your seatbelt on for me? Is she normally running round?
Oh, absolutely. She just doesn't sit still.
Doesn't sit still?
No.
Not worms?
No, well, she's got something.
She got something? It's all changed. Okie dokie, Wes. Off we go. We're moving.
Where are we going?
She's got lovely blue eyes, hasn't she?
Thank you. Normally she'd be talking back
Yeah.
to you and stuff.
You okay, Maddie?
And that's how she's been, where it's just been.
Just
Yeah.
the lights are on, but
Yeah.
nobody's there. She just looks like she's had like a really bad day at the office,
And you don't want to play
and you don't
anymore.
want to play anymore.
You just hate seeing them like this.
The last thing any parent wants is to see a child unwell or ill or anything like that.
It's horrible to see.
appears to be that the driving's very smooth, that it sent her to sleep.
Yeah.
Maddie! Hello!
Hello, sweetie pie.
Do you want to carry her in? I'll carry the bags. If you give me the bags,
Thank you so much.
I'll rep the handbag look. You ready, Maddie? Come on then.
Madison will be examined by paediatricians to see what might be causing her to seem so lethargic. They'll also run tests to see if she has the same condition as her brother.
She was worryingly quiet, but hopefully they find out if there's anything. It could be nothing, but with kids it's always difficult.
She may just be tired, isn't she?
Well, yeah, she may just be.
I mean, she was sound asleep when we dropped off.
Yeah.
Yeah, bless her cotton socks.
Bless her.
Have you been to many people that you know?
I've been to a few where they've been on scene. I've never actually treated anyone I knew.
I've been to a couple of people I know.
Yeah.
As patients, yeah.
Oh, really?
Yeah, that's strange.
Do you find it slightly awkward, or do you just get on?
I went to a girl that I went to school with. I think she found it a little bit awkward.
Yeah. I suppose for us it's okay, because
yeah, we're used to it, aren't we?
we're used to go, you know, a member of the public or whoever wouldn't just go to someone and say, oh, you know, how's your bowel movements been today?
Yeah.
Ambulance crewmates Jamie Busby and Jason Mitchell are 2 hours into their 12-hour shift.
We're going to an 89-year-old male who feels ill.
Okay.
He's got swollen legs and swollen feet, which are getting worse. He does suffer with cancer of the prostate. Pain is getting worse.
Okay.
It's been ages since I've worked with you.
It was a tech last time, I think, wasn't it?
Yeah, it was, huh? I want to see how you fare up being a para now. I want to make notes.
Crack on.
Jamie completed his paramedic training 4 months ago.
Out of the way! Get out of the way! Get out of my way!
Jason has worked as an ambulance technician for 17 years.
This one here, ground floor.
Doors open.
John. How are you, mate? All right? Oh, is it your dad? Come on, let's go and have a look at him. See what you've done to him.
John's son Paul has been waiting to direct the crew to his dad's flat. The alarm was raised by John's companion Elizabeth.
Hello. How are you? Right. What you done to him?
I'll bloody kill him.
Oh. Hi. How are you, young man? What's been going on? Swollen leg. Both of them.
How long have they been like that for?
Okay. So yesterday, were they normal size?
My feet are always
They're always swollen, are they?
swollen, they go down, they swell, they go down.
Today, are they bigger than normal?
Yes.
You know the swelling you normally get? Is it just in your feet, or do you get it up your legs as well?
No, it just comes about there.
So it only comes up to like sock height? Yeah. Any pain anywhere? A little bit in your chest and in your shoulder?
Between my shoulders.
All right, John. I'm Jason, and that's Jamie. So we've got all the J's today.
John and Elizabeth have shared a home since her husband, who was John's best friend, passed away several years ago.
I'm just going to put some sticky dots on you, young man, all right?
Thank you very much.
And we'll have a look what your ticker's doing. I'll just pop your finger in there. He's sorry nose at the fingertips, mate.
Oh.
Oh, hang on a second.
Any breathing problems previously?
My chest for the last few weeks.
Okay. Right, so let's have a listen to your chest, John. Come here, Chief. Nice deep breath for me.
bilateral crackles.
John was diagnosed with prostate cancer 12 months ago and has recently started a new course of treatment.
Do you know what injection it was that he had 2 weeks ago? Do you know what it was called?
I've had some treatment for a prostate.
Yeah. Have you ever noticed the colour of your fingers at the moment? They look a little bit blue to me. Turn your finger over.
Sorry, I mean, he's getting enough oxygen.
Pitching in his fingers as well.
Yeah, I'm wondering if it's heart failure. John, I'm just going to put some more sticky dots on your chest, all right? Just because you've had this pain in your chest. All right? That's it, matey.
Paul has found an information leaflet about John's medication, which he hopes might give the crew a clue as to what's going on with his dad.
What have we got there? Home care therapy. Okay. Let's have a look. Okay, it's a hormone injection. Side effects: tiredness, diabetes, cardiovascular issues. It may just be a result of the injection. Like looking at this,
Yeah.
you get, it almost looks like an intermittent flutter. See what I mean?
Yeah.
So there's definitely something going on with the atria.
Yeah. John's ECG showed an irregular heartbeat and the swelling in his legs. It was obviously a concern. It showed that the heart wasn't pumping sufficiently enough, which can then cause pooling in the legs. He had recently started a hormone injection for his prostate cancer. Side effects were water retention, so that could have been the cause of it as well. All right, John. We don't know why your legs are just suddenly starting to balloon again. Your heart tracing is showing an abnormality. So what we'll do, we'll pop you up to the hospital just so they can do some blood tests, make sure everything's okay. If everything's fine and they're happy with you, they'll send you back home.
What's your name, sorry, my darling?
Elizabeth.
Paul, my next second.
Paul, what's your surname?
Bolus.
You're not related to an Ash Bolus, are you?
He's on his way. He'll be here in about 5 minutes.
Who?
Ash.
It's my son.
Ash is not only Paul's son, he's a fellow student paramedic with West Midlands Ambulance Service and lives close by.
Hello.
All right, Petal.
Morning, Flower.
Oh, wait, mate, all right.
How are we, dear?
Pop him up.
Yeah.
Occurring some sort of heart failure or reaction to that, with a new query onset of a flutter as well.
There's potential. That's happened before.
Has it?
Has it?
Okay.
Ash is going to travel with his granddad to hospital.
It's a bit nippy out here, isn't it?
Especially with them shorts on. That's it. There we go. That'll do. 1, 2, 3. Up, 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 up. Good man.
Okay, John.
I'm very close to my granddad. He always worries about us as a family, but we always worry about him because he's at grand old age of 89. We call him the big friendly giant. He came over here in the early 50s from Ireland, has worked all of his life on the railway. Normally, the ambulance is my office. That is where I work. So it was very strange to be a passenger this time. But I was glad that I was off that day so that I could go with him to hospital.
If you can jump in, put your seat there for me and put your seatbelt on.
Oh, thank you, sir. Thank you so much. Hello.
Yeah.
No, this is, well, I finished at 11 last night. Up this morning. I've been shopping.
You shouldn't get that.
No. No.
You don't sleep.
No sleep. I'm like an owl. I'm nocturnal. Have your fingers always been this dark?
Yeah, man.
They have?
My hands are always cold.
Cold hands, warm heart. Something like that, isn't it? Really?
I'm happy when you are, Jay.
All right, mate.
You try and avoid hospital at all costs, didn't you?
I've never had to stay in the hospital.
No, you never went to your doctors though, did you? Off and on. Just every now and again, see if they're still there.
John has recently celebrated his 89th birthday.
We always have good family meals for your birthday, don't we? Everyone gets together, all of us. Grandad takes us all out for a meal, so we're all together.
It's nice, isn't
We have a
it?
nice big meal.
Remarkable for his age, isn't he?
We're at New Cross now. Oh, we've arrived.
We have.
Oh, hello.
All right. We are here.
I'll jump off first. I can do the work.
Are we happy?
I am.
Oh, hang on, we're moving.
Ash will head into A&E with his granddad, where doctors can start to explore what's causing the swelling in John's legs.
Really nice chap.
Bit of a surprise that he's Ash's granddad as well.
Yeah, hello, good.
To be fair, he's 89. Hasn't got a whole lot wrong with him. A little bit of heart failure. It's not the end of the world. People get scared by the word heart failure.
Yeah.
But they forget that the heart's a muscle.
That's right.
It gets tired, and it does start to lose its elasticity, that's all it is.
That's right, yeah.
And it's just a couple of medications to keep on top of the symptoms, like the fluid in his legs.
Yeah.
And he'll be right as rain again.
Claire, who suffered with the painful condition endometriosis, discovered at hospital that she was in fact 6 to 8 weeks pregnant, but had very sadly miscarried. She has since had further surgery and her pain is now more manageable. Baby Madison spent 3 days in hospital and is now healthy and back at home. She was diagnosed with hypoglycemia, or low blood sugar levels, but the doctors think this was the result of her vomiting rather than a sign of a more serious condition. Doctors have not been able to find the reason for Ash's grandfather John's swollen feet, but he is feeling much better. He'll continue having hormone injections every 3 months to treat his prostate cancer. Jane, who was suffering with cancer and whose family called the paramedics when she was struggling to pass urine, was diagnosed with sepsis at hospital. Due to the nature of her illness, she was referred to the palliative care team. She peacefully passed away 6 days later.
She's heading into training next to learn the ins and outs of being a midwife. Stay tuned for Emma Willis, Delivering Babies.